Today we're going to talk about a topic that is rather touchy for a lot of women, obesity in pregnancy. This video is not about body shaming, rather about discussing the risks associated with being pregnant and obese. If you stick around, I will give you some suggestions that can help decrease those risks and increase your likelihood of having a very normal pregnancy and a beautiful, healthy baby in the end. Obesity is defined as having a body mass index, a BMI of 30 or more. Not sure what your BMI is? It's easy to figure out. Just Google BMI calculators. A number of programs will come up. You plug in your height and your weight, and you will be assigned a numerical value. The higher your number is, the more you are at increased risk to develop high blood pressure, preeclampsia, gestational diabetes, sleep apnea. Your baby is at increased risk to have a cardiac defect or a neural tube defect such as spina bifida. Statistically, women who are obese tend to have longer labors and are at increased risk to require cesarean section deliveries. Here's the good news. There are things that you can do to help decrease those risks. In a perfect world, we'd like for you to be taking a prenatal vitamin that contains folic acid, ideally 1 to 2 months before you get pregnant, and already working on weight management. If you are already pregnant, we recommend you aim to gain somewhere in the neighborhood of 11 to 20 pounds during your pregnancy. How are you going to do that? Excellent nutrition. Fruits and vegetables, whole grain breads and cereals, lean meat. If you can schedule a nutritional consult, I encourage you to do so. I want you to stay really well hydrated. If you are thirsty or your urine is darker in color, you are dehydrated, please drink more water. Take a prenatal vitamin every single day. Studies show that if you take 5 milligrams or 500 micrograms of folic acid, you significantly decrease your risk of having a baby with a neural tube defect. Exercise. If you were already exercising prior to pregnancy, continue to do so. If you were not already active, now's a good time to start. Start out slow, increase gradually as tolerated, listen to your body. Walking and swimming are 2 excellent exercises during pregnancy. Ideally, we want you active 30 minutes a day, most days of the week. Regular prenatal care. In the beginning, your provider may recommend that you do an early glucose tolerance test. That is to see if you are a pre-existing diabetic. If you pass that test, you'll still need to do the real test between 24 to 28 weeks to see if you are a gestational diabetic. They may recommend that you start taking a low dose or a baby aspirin after 12 weeks. The purpose of that is to decrease your risk of developing preeclampsia. Your OB may order a level 2 or a higher level ultrasound, which includes a fetal echocardiogram, so they can take a close look at the baby's heart. If your BMI is 40 or more, you may be scheduled for growth scans monthly starting at 28 weeks to make sure your baby is growing properly, and you may have non-stress tests every week in the last month. Those are simple tests. You lie in a recliner, they put belts on, they monitor the baby's heart rate for 20 to 30 minutes. Your OB may not want you to go too far beyond your due date. It's going to be recommended that you breastfeed. Couple of reasons. First of all, it's best nutrition for the baby. Second, excellent for bonding. And third, it is going to help you kickstart that weight loss after you have the baby. I'm going to encourage you to keep a pregnancy journal. Write down those questions so that at every visit you can best meet your own healthcare needs. In the meantime, if you have any questions that I can answer for you, please leave them in the comments section below. While you're down there, go ahead and hit that like button.
You're still here. Thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CeeJay. I'm at your cervix.